So there are plenty of people out there who either don't understand axis deviation or it's confusing to them or they don't see the value in it. But I'm here to tell you today that axis deviation is super important and that with a little bit of practice, you can get good at it. And then it can give you actually a wealth of information about your patient, about their cardiac condition. And I can tell you in my career, knowing axis deviation has actually helped me out a tremendous amount of times to make sure I'm doing the right diagnosis for my patient. My name is John Carrico. This is Pulse Education. Welcome back to the channel. Thanks for joining us once again. This week, we are talking about axis determination. This is step 2 of our disciplined approach to a 12 lead. Last week, we talked about rate and regularity. This week, we're going to be spending it all on determining axis. And we're actually going to break this into a couple different parts. So this is going to be part 1, more to come on axis determination. We're going to make this digestible so you can understand it, so you can get good at it, and you can start applying it to the 12 leads that you're doing to your patients each and every day. All right, so let's get started. Why is this important, right? Why are we even doing this? Well, a couple of reasons. One, it tells us about the health of the heart's conduction system, right? So it tells us if we're normally the conduction system is working normally. And when that happens, we have an efficient heart, all right? So that's important for our patients. Secondly, when our conduction system is not working properly, it actually, and using our axis determination, it actually can help us predict which patients in a cardiac event potentially will become hemodynamically unstable or potentially develop a lethal dysrhythmia, okay? Hugely important. And then finally, it can also help us in terms of diagnosing or ruling out a patient who's in VTAC. Furthermore, it's going to also just help you in terms of when you're making some decisions on what exactly is going on in this 12 lead. By knowing your axis, it can actually help you in terms of ruling things in and ruling things out. All right, it just takes a little bit of practice, but I promise you can get good at it with just that little bit of practice and dedication. Okay, so what are we talking about here in terms of axis? All right, normal axis, first of all. Well, we know that within the myocardium, we have lots of cells that are all kind of facing different directions and kind of straddled all over each other so that when the ventricles fire off, they kind of wring that ventricle out to eject the most amount of blood that it can, okay? So they're all firing in different directions. But what happens is when we have that initial depolarization that starts in that SA node and it starts traveling down the conduction pathways, and as it does, it's going to tell all these cells along the way to also fire off. And that's through the power of conductivity, right? That it can do that. And that's fine and good as it does that and it all depolarizes, okay? But what axis tells us is actually, it doesn't care. Axis isn't about what all those little cells are individually doing. It's looking at the collective. And what we're looking for is actually the average direction of that depolarization within the heart, okay? That's all that axis is. It's the average direction or the mean direction of the depolarization wave throughout the heart, okay? That's it. That's simply all it is. But what can happen is that with different pathologies, right, or as the different ventricles stress or strain, that can actually change that average direction. And by doing that, that can help us diagnose some of the pathologies that our patient could be experiencing, okay? Today, we're just going to talk about normal conduction and normal axis, all right? And when we think of normal axis, it's this green arrow is kind of represents normal axis. And that is where the axis starts in the right atrium and it kind of works its way down and it finishes down there in the apex of the left ventricle, okay? Normal axis, that is the normal average direction of depolarization within the heart. That's all axis is, okay? And now we're just gonna kind of look at it when things aren't always normal, okay? Perfect. So one of the cool things that we can do then in order to actually help us put a numerical value on axis, right? So that we can actually really coordinate exactly where that axis is that we use degrees. And so we use this thing called the hexaxial system, all right? And all that means is it's a numerical system, and you can see it on here for a way of numerically determining exactly where that average direction is. The good news is that we're not doing that. You know, the computer itself is going to be very accurate in terms of mathematically calculating exactly where that average direction goes. Okay, and we'll look at that here momentarily. But you can see we have this range. Our normal axis, which we're going to spend talking about today, is between 0 degrees and positive 90 degrees. In future episodes, we're going to talk about right axis deviation, which is this positive 90 degrees to 180 degrees. We'll talk about left axis from 0 to negative 90, and then we'll talk about extreme axis when that is above 180 degrees. Okay, but for today, let's just talk about normal axis. So again, if that axis falls anywhere between 0 degrees and 90 degrees, so that green arrow were to come down here and fall anywhere in there, that's what we consider normal. And that means the conduction system is working like it should be within our patient's heart. Okay? So, as I said, one of the cool things is that the monitor itself will actually help us mathematically calculate exactly where that axis is. And so all we need to do is when we print out our 12 lead, we're going to be looking on the 12 lead itself. We're going to have that box that's going to have all those numbers, and one of those is going to be the axis area. And a lot of them will say PRT or PQRST axis. And we're looking for is that middle number that corresponds with our QRS complex or the R axis. And you can see in this one, it says 67 degrees. Well, that is between 0 and positive 90. So in this patient's 12 lead, that we can see that their axis is normal, okay? And again, that tells us that we have normal conduction going on, especially within the ventricles, and that means that we have good efficiency. Okay, again, normal looking axis there when that happens. Perfect. So another way that we can determine what our axis is actually looking at the leads themselves. And by being able to do this and not just looking at the numbers, actually, that can be really beneficial. And what that means is we have to remember about the QRS and the direction in which the QRS is facing, right? And so we've talked about in past videos before that the direction of the QRS, whether it's positive, whether it's negative, or whether it's equiphasic or biphasic, has to do with the camera or the lead in terms of how it's relatively looking at that depolarization wave. And so under normal axis, our green arrow that we've been talking about, if it's moving towards our lead, it's going to be a positive. If it's moving away from that lead, it will be negative. And if it's moving at about 90 degrees, it's going to be biphasic or equiphasic. Okay. So in order to apply this to axis, okay, and determining axis, all right, we're going to look at our first three leads 1, 2, and 3. All right, that's all we need to look at, okay? And if we look at these three leads, what we're looking at here is we're going to see, again, in relationship to that depolarization wave about which way it's moving. So in lead one is looking at that left lateral wall of the left ventricle. You can see lead 2 is looking from below, kind of on that left side at the left ventricle. And then lead 3 is also looking straight up from below as well, okay? It's hard to exactly see that from that in a three-dimensional model, but it is, okay? And so if we apply our normal depolarization wave, okay, lead 1 is going to be positive. Even though it's not moving directly toward it, it's moving in the general direction of lead 1. It's definitely moving in the general direction of lead 2. And it's still moving in the general direction of lead 3 if you imagine them looking from directly below in a three-dimensional model. So all three of these under a normal depolarization are going to be a positive QRS or upright. And that indicates normal axis. All right. So if leads 1, 2, and 3 are all, their QRSs are all positive, that's going to be normal axis. The same as having between 0 degrees and positive 90 degrees. All right, just like this. All right. So hopefully this is starting to make a little bit of sense right now, okay? That we're using this degrees system to numerically calculate, or we can just use the actual leads 1, 2, and 3 and the direction of their QRS complexes. Perfect. So again, why is this important? Well, under normal axis, that means we've got normal ventricular conduction, which then equates to an efficient squeezing of that ventricle that's firing off. So let's look at this one here, and let's take this from the beginning. Like, let's apply all our steps right here. So we'll look at rate and regularity first. So we'll pull up rate. In this case, we have a rate of 112. That's fast, but not too fast. We look at the regularity. It marches out. The QRS complexes marches out, so it is regular. All right. Now we're going to look at the axis. So we determine that axis. We can do one of two things. We can look at the leads. Lead 1 is upright, lead 2 is upright, and lead 3 is upright. Or if we look at our numbers, we can see that it is saying 51 degrees. So in this case, that would be normal axis. It's between 0 and positive 90. Leads 1, 2, and 3, all the QRS complexes are all positive or upright. That's normal axis. The conduction system is working normally. Hopefully that makes good sense now. All right, let's look at another one here. All right, so in this case, we're gonna first again look at our rate. We pull up our rate, and our rate says 92. All right, so that's not too fast, not too slow. We look at our regularity, and we can clearly see that there is some irregularity here. Actually, it's completely irregular. All right, which to us we start to think about potentially underlying atrial fibrillation. All right, so we've got our rate, we've got our regularity. Let's determine axis. Okay, we can see up here, lead 1 is upright, lead 2 is not upright, it's negative, and lead 3 is not upright, it's negative. So this is not our normal axis. And if we look at our number here, we can see that says negative 69. All right, certainly negative 69. That is not between 0 and 90 degrees. So this is not a normal axis. What does that mean? Well, it means that we need to determine whether this is a left axis or a right axis deviation. And we're going to do that in the videos to come. All right, hopefully this makes sense. All right, you've got a little bit better indication at least of what we're talking about, the average direction of depolarization within the heart, okay? And if it's between 0 degrees and 90 degrees, or leads 1, 2, and 3 are upright, that is normal axis. Conduction is working normally in the heart. Okay, thanks for joining us this week. Again, this is video 1 of our axis determination, and we're going to go through this and make sure that you guys know it really well. And that you're going to be really confident in applying axis determination at the 12 leads in the future. Thanks for joining us. Please, if you like this, let us know. Like the video, subscribe to the channel, send us comments, follow us along on our Instagram page. Thanks again, and we'll see you next time.